this is just sort of advice for take it or leave it, right?
Yeah,
I'm a guy who's done this for almost 30 years. I hear a lot, including companies that I advise, and I'm not so sure that's the wisest choice. So I hear a lot from people, we want to do something, we're going to create a COVID X, Y, and Z. And everyone in their heart of hearts wants to be part of the solution, and that's great.
Yep.
And it does bring out, people who are in business that are kind of, especially on the investor side, can be cold-hearted. It's bringing out the best in them. But with that said, if that thing that you want to create is a pivot for your company, that's not a good idea. Because you're going to burn through capital, you're going to distract yourself. I think you're better off. Now, if for instance, Bowie Health is a company that's local here that does symptom checking. So for them to do a COVID symptom checker, it's right down the fairway.
Yep.
Right. So something like that, great. Thank you.
Pivot.
Yeah. Thank you for that. And we appreciate it. But for a lot of people who come in and say, I think we could do X. If it's not within your normal project business plan, I wouldn't recommend it. It might make you feel good today, but boy, it'll take you off kilter. And as you know, and you've done so many of these sessions with so many interesting people, it takes a lot of effort to get this stuff right. So that's one thing. I think the other thing that is frustrating is that so many people now, and again, I get a lot of incoming, which I'm grateful for. I love to be, something I didn't mention when you were asking me about my, the hats that I wear is I'm a board member and advisor to a number of companies. So I love the commercial side.
Yeah.
So I do end up hearing from a lot of people. And what I have to say to them is, yes, you're right. You have the perfect X, but the people where I work, for instance, and I can really only speak most thoughtfully about them, they've already made the decision to ask why to do that. Even though your X is perfect, they've already decided to hire Y.
Yeah.
They can't stop what they're doing and vet what you have. They just can't. And that's sad, but it don't, think that you're going to make the usual 18-month sales cycle go down to 2 weeks. It's not, it's the opposite. Like they're shutting out people because they're focused on, okay, well, we made a decision to implement X. And, in the remote monitoring space, that's probably the hardest because there's so many interesting new patches or rings to wear or sensors or things like that, or things where you can hang up a sheet of what looks like a sheet of paper in the house and monitor people. Most of that's not getting any traction whatsoever. It was either doesn't have FDA clearance or, it doesn't have a clear marketing path. You're the expert on that, the path to market. So I hear from a lot of those people and they're frustrated, and I'm sorry, and I don't blame them, because a lot of those innovations are exactly what we need, but it's just in a crisis, they're not going to go anywhere, unfortunately.